minutes. We just want to give everyone some time just to join. So feel free in the meantime to introduce yourselves in the chat by simply just telling us your name and the organization you will be representing today. All right, everyone. We're just gonna start with the workshop, and individuals, if they haven't already joined, they'll start to trickle on in. To begin, my name is King. Um, I am the community engagement coordinator, and today myself and my coworkers, Jasmine Gaudet and Maria Lisa Moreras, we will be providing a training on respiratory health. All right. So before we actually begin the presentation, we just wanted to go over a few things like interpretation services. So today we will have simultaneous interpretations. To participate in this session or in another language, all you have to do is press the globe icon at the bottom of your screen. Then choose which language you would like to use. First and foremost, we would like to thank our interpreters for being here and providing assistance for our presentation. Today's training will be available in Spanish and ASL for those who need it. This session will be recorded and uploaded to our YouTube, so anyone who couldn't attend the session can still get the information. The recording link will also be sent out in a follow-up email along with the presentation slides at a later date for individuals who weren't able to attend the full training. If you have questions throughout the session, please type them in the chat below. We'll answer all questions at the end, or we'll type the answers back to you during the presentation. If you are calling in and your questions are not answered, you can call us at 215-685-5488 or email us at publichealthpreparedness@phila.gov. Thanks to everyone from the health department here to answer questions. All right, so today's training, it's specifically geared towards a vital group in our communities, which are trusted messengers. We all have someone we look to and trust for information, right? It could be a family member, it could be a friend, it could be a healthcare provider, a community leader, and the list goes on and on. Trusted messengers, they make an impact on what we think and how we act, and provide us with important information. Chances are 9 times out of 10, maybe you are that person to someone or multiple people. And with this training, we hope that this will help inform and educate all of you on how to stay safe this fall season, but also how to share and teach and prepare your communities to plan, prepare, and respond to respiratory viruses this season. All right, So there are numerous reasons why trusted messengers are so important. Some of them being they deliver accurate information and provide resources. They create a space for community members to share their thoughts and concerns. They know and build trusted relationships with the community members, which is somebody we do want to have in our corner. So we would like to thank you all for being such key members of our communities and helping keep everyone safe. All right. So for today, we will discuss the respiratory viruses most common in the Philadelphia area this season. And since you all are pretty busy individuals, we are going to start the presentation by highlighting resources from the city of Philadelphia, such as where to get free testings, vaccines, housing and utility assistance, and mental health support. Then we will discuss the big three viruses, things like what they are, how do they spread, and how you can keep your community safe. And then lastly, we'll discuss updated vaccines and where to get them for free. We hope that this presentation has useful information, so please let us know any suggestions you may have on how we can improve our presentation for other individuals in the future. So now we're going to jump right into discussing the resources the city is offering this fall. The first resource we'll discuss are the free at-home COVID testing kits. So PDPH has resource hubs around the city that distribute at-home testing kits, and they provide many other resources like hand sanitizer, HIV test kits, harm reductions supplies, and the list goes on and on. What's cool about these resource hubs is there's no insurance or IDs insurance and IDs are not needed when visiting the resource hub. So if you know anyone who honestly doesn't have insurance, or maybe they lost their ID and haven't been able to get a new one, this is a great resource for them. If individuals weren't sure as to where these resource hubs are located, how to find them, great, because we already answered those questions for you. All you'd have to do is click on the link below, and it will show you the hours of operations, the locations, as to which resource hubs will be closest to you for you to make the best decisions as to where to go. Another resource available are low-cost vaccines. Free or low-cost vaccines are offered for people without insurance and are available at health centers around the city of Philadelphia. Please be sure to remind community members to call health centers in advance to ensure that they have the vaccine that individuals are looking for. So they just potentially, let's say if they decide to go to Health Center 3, they may not have the COVID vaccine that they were looking for, right? So we call just to emphasize that point, just to make sure they have it. Uh, so you can also visit the link for locations and hours of health centers closest to you. Like I previously stated, if you don't know where they're located, we do have the link, the bit.ly link up at the right-hand corner that you can click, and it will show you the hours and operations and also the locations. In addition to the two resources we spoke about, we also have the PDPH call center. The PDPH call center will answer questions you may have about COVID-19 testing site information, resources, and places to get vaccinated. In addition, they can also provide vaccine record requests, public health guidance, and other information. The hours in operations are usually Monday through Friday from 8:30 a.m. to 5 p.m. It may vary, so calling can always help out just to figure out specifically what those hours are, just in case they are closing earlier for a specific day. Interpretation Interpretation in other languages are also offered. The number is listed above for you all. All you would have to do is simply just press 2 for Spanish and then 3 for other languages. Everyone needs to have a doctor or primary care provider that they can trust. It is important to have a trusted primary care provider who can answer questions and concerns, especially in times of public health information uncertainty, right? We like to remind everyone that it is okay to switch primary care doctors until you find one that fits your needs and makes you comfortable. Why? Like, for example, with me, usually before I find my primary care doctor or provider, whenever I visited a healthcare center or went to go see my primary care provider, I spent ample amount of time sitting in a waiting room and only 3 minutes actually speaking with my primary care provider. And that wasn't very helpful for me because I spent more time waiting than actually receiving information about whatever issues I may or may not have. Um, so I decided to then try to find a primary care provider that I felt like cared about me, cared about the information that I had to say, and was able to provide me with great solutions. So it's always okay to switch health primary care providers if needed. A primary care provider can help people stay healthy and treat any health problems that arise. Contacting a primary care physician when someone is experiencing any health concerns or if they have any questions about their health or public health guidance is essential. This website lets members search for providers by location, by language offered, and specialties. It is designed specifically for people who are uninsured or underinsured and need free or low cost medical care. All right. So another resource that the PDPH offers are our materials. As we gear up for the winter, make sure your network is connected. Oh, wait, as we gear up for the winter, we want to make sure that we have the most up-to-date information for how to keep ourselves safe. And we can do that through staying safe through our severe weather brochures, our utility assistance guide, whatever, essentially used for helping us out, and then also we also have our winter newsletter. Our winter newsletter essentially has all the information that anything relating to the public health department. And if you wanted any of these resources in addition to a couple of other resources, all you'd have to do is click on the bit.ly that you do see on your screen. It will take you to a web page where you'll fill out a request form, and then we can provide you with materials. We can provide those materials by either mailing them to your home address, or you guys can come and pick them up from our centralized home. So the good thing about these materials are they are free, they will be printed in color, and can be delivered to your address. And this is the perfect way to ensure that you have updated materials to hand out to your community members and coworkers. All right. So the neighborhood energy centers. So this is a great way for individuals. This is a great way to help individuals weatherize their homes, understand bills, and connect with additional assistances. To go to the website or scan the QR code to view the neighborhood energy centers, hours, and locations if this is something that interests you or you know someone that can benefit from this. All right. Next, we have the Utility Emergency Service Fund. So this helps stabilize, or USIF, this helps stabilize housing for families facing a housing crisis by addressing their immediate needs and removing the barriers to long-term stability. Their hours of operation are Monday through Friday, 8 a.m. to 5 p.m. You can always visit their website to learn more information or scan the QR code you see above for the contact form. Next we have, which is Bennett Philadelphia, which offers one-on-one support to connect residents with non-income based benefits and helps affording costs such as things just like prescription drugs, health insurance, general necessities like food, paying for college, which is a big one, honestly, and heat and other utilities, in addition to disability benefits. And lastly, your mental health and well-being, your mental health and well-being are very important. If someone is experiencing a mental health crisis, we please we would please like you to share this number with them, which would be 215-685-6440. And interpretation is available in addition to being able to access this number or access this service 24/7. Another good resource is the National Suicide Prevention Hotline. We like to call this the this is the 911 number of the suicide line prevention, which would just be 988. This is easy to remember, and it is also open 24/7. Another resource that we also do have available is free online behavioral health screening and resources, which you can visit healthymindsphilly.org for that information. And now I'm going to be shifting over to Jasmine, where she'll be talking about the three big respiratory viruses.
Good morning, everyone. Thank you again for joining our respiratory health virus workshop. I will be discussing the three important respiratory viruses for this season, which I'm sure we are all very familiar with at this time. So we have influenza, flu, which is flu, COVID-19, and respiratory syncytial virus, which is RSV. The best ways to protect yourself against these viruses are by obtaining your vaccines, um, practicing any prevention methods, testing, and obtaining treatment if needed. As you know, seasonal flu is a common respiratory infection that can affect the nose, throat, and sometimes the lungs. And the season runs from October all the way through April. Each year, vaccines are updated to protect against the most common or concerning strains of the virus. Ideally, people should get vaccinated in September or October, but it is still useful later in the season since the flu activity often peaks in February and can continue through late April, early May. So if you haven't gotten your flu vaccine yet, or you know community members that haven't gotten their flu vaccine, it's still important to encourage them to get it later this month, early next month. If they have to wait until December, can still encourage them to get it. But the earlier, the better, because it'll protect you and your community members throughout the whole season. Everyone in your community 6 months or older should get the flu vaccine each year. We like to remind community members that the vaccine cannot cause the flu, and that the side effects are usually mild, such as arm soreness, headache, fatigue, and typically resolve themselves in just a few days. So remind your community members of that when they are reluctant to get the vaccine. Getting the vaccine protects people from severe illness and helps prevent spreading flu to others who may get very, very sick or even die from the flu. Next up, we'll talk about COVID. COVID usually affects the upper respiratory system, but can cause serious illness in some people in your community. It can cause pneumonia or other respiratory issues in older adults and people with um, affected immune systems. Sorry about that. Since 2019, the virus has changed multiple times. And just like the flu, the vaccines have been updated every year to protect against the new strains of the virus. Just like with the flu as well, everyone 6 months and older is eligible for an updated COVID vaccine. Staying up to date is especially important for people at higher risk of severe illness, such as older adults, 65 years and older, people with underlying medical conditions, young children who haven't been vaccinated, and those who are pregnant or postpartum. You can receive your RSV, COVID, and flu vaccines all at the same time if you would like. It's safe for community members to get them all three at the same time if they're eligible. RSV, or respiratory syncytial virus, is a common respiratory virus that can cause most people in your community to have mild cold like symptoms like a runny nose, cough, or sore throat. But RSV can be serious for certain groups, especially infants and older adults. In older adults, RSV can sometimes lead to more serious problems such as pneumonia, worsening asthma or chronic obstructive pulmonary disease, which is also known as COPD, heart issues like congestive heart failure. It can also lead to bronchiolitis and pneumonia in infants as well. The updated guidance for these groups, these groups mean that these groups should be protected. All adults 75 years or older are eligible for the vaccine. Adults 50 years and older who are at increase of severe RSV disease are recommended to get the vaccine. Pregnant people to protect their newborns should get the vaccine as well. And infants under 8 months whose birthing parents did not receive the RSV vaccination can get the RSV antibody during their first RSV season. That sounds like a lot, but people in the community should talk to their primary care physicians, their pediatricians, to see whether or not they are eligible for RSV vaccination or immunization. And reminding everyone in the community that this is a one and done shot. Once you get it once, you don't have to get it every year like the flu or COVID. Flu, RSV, COVID-19 all share many symptoms from mild to severe. Those can include fever, chills, fatigue, cough, and headache. Testing is needed to know which virus is present. Most importantly, you want to share with your community members that the combination COVID flu tests that are now available at the city resource hubs that King mentioned are a good way to test for those two, three virus. So flu A, flu B, and COVID. The public health information landscape is always changing, so staying connected to reliable sources is key for you and your community. Encouraging community members to connect with a trusted primary care provider is very helpful, just like King mentioned earlier. It's a great way to make sure that you have the health information that you need. So sharing that primary care provider link with your community members will help them. Our network specifically shares newsletters with the latest public health updates. Consider subscribing and sharing these newsletters with your community as well. The Philadelphia Department of Public Health website is regularly updated with local guidance that reflects federal recommendations. This is a reliable source to share with your community members so that everyone can stay in the loop with the changing landscape currently. Next up, I will turn it over to Maria, who will discuss how respiratory viruses spread.
Thank you, Jasmine. Okay, so now we're going to talk about how these respiratory viruses are spread in our communities. So to kick things off, we'll start with a poll question that just popped up on your screen. The question is, which strategy will not prevent the spread of respiratory viruses? And your options are A, hand washing, B, immunizations, C, cook food to recommended temperatures, or D, stay home if you are sick. So we'll give you all about a minute or so to answer, and then we will check the results. And so far, it does look like everyone is answering correctly, so that is great. Okay, a few more seconds here. It looks like we have a little over half have responded. So everyone, with the majority of folks answered C, cook food to temperatures that are recommended. So that is the correct answer. So that is a great strategy for preventing foodborne illness. However, that is not going to help with a respiratory virus. The other tips would. So we can go right into our content now. And we will discuss how all three viruses are spread. Again, we're talking about flu, COVID, and RSV. So all three of these viruses are spread in the same way. So our three ways are listed here, primarily through the air when an infected person coughs, sneezes, talks, and then another person inhales those particles, or those particles come into direct contact with another person's eyes, nose, or mouth. Sometimes you can even catch these viruses by touching contaminated objects or surfaces and then touching your face. And people can spread the virus before they even know that they're sick, since you may not have symptoms. And this is called asymptomatic spread. So you can still spread the virus, but you may not have symptoms, so you don't even know you're sick. And the spread of viruses by asymptomatic people is one reason why it's very important to wear a mask in crowded public spaces, because you don't know who's sick just based on symptoms. You can't rely just on that. So we'll talk about seasonal spread now. So as a quick reminder, more people get sick in the fall and winter, and that's because folks are typically indoors, the holidays, it's cold out, you don't want to be outside. So this is a time for an increase in respiratory virus transmission. As well, we have people traveling for the holidays. And the air is colder and drier, and this helps viruses spread more easily. So this is why we want to remind you all to remind your community, your family, your neighbors, anyone you're in contact with, really, that everyone should stay up to date on their vaccines. This will help protect not only themselves, but their loved ones throughout the holidays and the colder months. So think of it as a holiday gift to your family members. So you're helping them avoid a doctor's trip or a hospital visit or even worse. Okay, so preventing the spread, again, we're talking about these three. So flu, COVID, RSV. These are the top three that we're discussing today. And again, core prevention strategies apply to all three of these. So since they are spread this in similar ways, we'll also take very similar precautions to help protect against all of them. So the best ways for people to protect themselves are, again, staying up to date on your vaccines, washing your hands often, staying home when you're sick. Again, you're getting the rest you need, but you're also protecting your loved ones, your community, your family members, your coworkers, anyone. And talk to your doctor when needed. So if you feel like you're getting sick, reach out. I'm sure a lot of institutions have my chart. It's very easy to reach out to your doctor. I know I do this all the time. Better safe than sorry. Keeping fresh air flowing indoors, so circulate air. You could crack a window. I know it's cold out, but sometimes a little bit of a crack won't impact the air inside too much. So other tools like masking or testing can be helpful in certain situations. So three instances where this would be helpful is there's a lot of illness spreading in your community. So let's say you work in an office and everyone is sick. You're going to want a mask and take a test because you may not have symptoms and you might be sick. Or if a lot of people in your church are sick and you go regularly, that's another instance. Or if someone was recently exposed or just recovered. So if you hear about a neighbor who comes over to your house for dinner often and they have been exposed or sick recently, you're going to want a mask or test. Or if you or someone around you is at higher risk for severe illness. So we'll talk about folks that are at risk for severe illness, but what comes to mind is an older adult, or someone that just had surgery, someone who's immunocompromised. So if you're going to be with that person, helping them out, and you've been exposed, or you just want to make sure you don't bring anything to them, again, mask and take a test. So another example is people should wear a mask if you just recovered from being sick and if you're about to visit an elderly family member. So again, thinking about everyone around us. So it might be uncomfortable to wear a mask. We might be over it by now, but think about that elderly family member who will have a very hard time and maybe a hospitalization. So a few moments of uncomfort could save someone's life. Then every layer of protection helps, and even these small steps make a difference. So remembering these key strategies will help. So we talked a little bit in the previous slide about some folks that are at risk for serious illness. We'll go through them right now. So we have older adults, babies and young children under 5, people with weakened immune systems, people with disabilities, pregnant folks, people with certain health conditions, and people who have not been vaccinated. So when we talk about folks with underlying medical conditions or weakened immune systems, we want to think about people with heart conditions, cancer, diabetes, high blood pressure, HIV, respiratory diseases like asthma, COPD, which is chronic obstructive pulmonary disease, lung cancer, and more. So these are very common, especially in our city. I'm sure you know a handful of folks that fall into these categories. So just think about taking the prevention strategies would help protect these people in these very high risk groups. So anyone in these categories experiencing any sickness should always reach out to their primary care provider. So King talked about the importance of having someone that you're comfortable with, and this is definitely a time where some folks might feel like they're bothering their doctor by messaging a lot, but please do so, especially if you're in these categories. Always reach out. This is very important so they can be aware of the options, and hopefully more severe illness can be prevented. It's also important that people living with or taking care of people at risk protect themselves from getting sick or passing on illness. So if you're a caretaker to someone that falls into these categories, you want to keep taking the prevention measures, washing your hands, wearing a mask, testing every so often. Again, you're helping yourself and them. So we also want to think about social and environmental factors. So people whose jobs and living environments expose them to respiratory illnesses also need to take extra care during the colder months. So some examples would be for a nurse or a home health aide. So these are folks that are more at risk because of their jobs. So people with less access to medical care, lack of access to healthy food, and people who live in neighborhoods with poor air quality may be at increased risk of serious illness. So this list is not all encompassing, and groups that have been previously mentioned for risk factors may also fall into these categories. So you might have heart disease and high blood pressure, and also have a lack of access to healthy foods. So you're falling into multiple categories. Again, stressing the importance of why you want to tell everyone that relies on you for trusted information, since you all are trusted messengers. Just push this message out that better safe than sorry. Take a test. It's very quick. Wear a mask. It is uncomfortable at times, but just think about how uncomfortable an elderly person will be not able to breathe or in the hospital for severe illness. Okay, so we'll talk about what to do if you get sick, if you are exposed to one of these viruses and do end up getting sick. So, exposure. What to do if you are exposed. So, if someone in your community has been exposed to a respiratory virus, you want to encourage them to monitor how they feel over the next week or two and take extra precautions during that time. So, they can write down in a journal or a planner when their symptoms started, the progression of these symptoms, and they also want to take the extra precautions we talked about here. Remind your network, especially those at high risk for illness, to reach out to their healthcare provider early with any questions or concerns. So again, you all are trusted messengers. Anyone that relies on you for any type of information, you let them know that if they're at risk for a higher risk, for serious illness, that they should reach out to their doctor. And if they do not have a trusted healthcare provider, you could pass on the link to them so they can find one. Sharing these reminders helps protect both individual health and the broader community. So you're not only helping the direct people that you love and care for, but also the people in your neighborhood, the people that go to your church, your synagogue, your mosque, everyone that is in your community where they eat, pray, love, sleep, all of that stuff. So you're doing a really great deed. Okay, so we'll talk about testing now. Um, so we talked a little bit about the resource hubs earlier of where to get the test. So now we'll actually talk about the tests. So since these three viruses, flu, COVID, and RSV, look very similar, remind your community that symptoms alone can't tell which virus you have. So the only way to know which one you have is to test. So there is an at-home combination test that is available at the resource hubs, and they are free. They test for flu A, flu B, and COVID. So it's one test, and you'll find out if you have one of these or two or all three. So hopefully everyone after this presentation will not fall into any of those categories and take the prevention measures. So you want to encourage people who are feeling sick to take a test. It helps them to understand their treatment options, especially if they're at higher risk for severe illness. You can contact your doctor, let them know you tested positive, and you can start an antiviral. So I know that I had symptoms some years back, and I tested pretty early and let my doctor know immediately, sent them a picture of my positive COVID test, and I was prescribed Paxlovid. And I started it the same day and started feeling better, honestly, the next morning. So again, it's very important to test, reach out to your doctor, stay in communication, and you can get a treatment option that will help your symptoms go away. So the health department recommends testing for COVID-19 if someone has symptoms or if they plan to be around someone who could get very sick. So if you're going to be around someone who falls into one of those categories, where they can possibly experience severe illness, you want to take a test. Even people who test positive without symptoms can spread the virus. So encourage them to contact their healthcare provider and take extra precautions for at least 5 days. So if you test positive and do not have symptoms, treat it as if you did have symptoms. So for 5 days, wash your hands, cover your cough, and avoid contact with folks who are in those high risk groups. So the bottom line is you can't guess which virus you have. The only way to know is to test and let your community know where to pick up free tests. Nearby would be the resource hubs. So these key messages, again, you don't know which virus you have unless you test, and there are free combo tests available at resource hubs. You can go in there and pick up, I believe it's 2 per person. So you can save yourself some money, save yourself some hassle, and protect your health. So this next slide, we see a picture of the combo test. So again, this year, the resource hubs are providing the combo tests, which looks for flu A, B, and COVID, very similar to the one we had available last year. Or last season, I'm sorry. So what to do if you are sick. So the key messages to share with everyone you know, your loved ones, your family members, your household members, your neighbors. If someone has a respiratory symptom, they should stay home and avoid close contact with others. Remind community members who are at higher risk, whether it's due to age or health conditions, to contact their healthcare provider right away if they've been sick or if they've been exposed. So if someone tells them like, hey, I had COVID the whole time we were hanging out last week, or while we were sharing a cube at work, or when I came to visit you, this is a time to take a test. So people can return to normal activities once their symptoms are clearly improving and they've had no fever for 24 hours without using a fever reducing medicine. So if your fever goes away on its own. So once they're back out, encourage them to keep protecting others for at least 5 days. Again, better safe than sorry. Take a few extra measures. You could wear a mask, keep your distance from folks, keep circulating air in your home. These things can all make a difference. And the more precautions we take, the healthier our whole community stays. Again, it's a bigger picture than just what's happening with ourselves or in our household, but it's your household, your block, your neighborhood, your community. So just think about that. And again, there's some links in the chat with some guidance if you want a refresher or you need to share some links with people. Okay, so again, what to do if you're sick? We will go. This is very repetitive because we want you all to really drill these points home with the folks you share information with because they see you as a trusted source. And we know this is very important right now with the climate of public health. Unfortunately, the way things are now. So we're relying on you to help us spread the word. So most people can manage respiratory illnesses at home by resting, staying hydrated, and taking medication as needed. Even people with mild virus can be prescribed antiviral medications by their doctor. Again, this is what happened to me. I didn't have severe symptoms, but enough that it was bothersome. And the antiviral that I started helped me immediately. So these work best when started early. And you should you should contact your healthcare provider as soon as your symptoms begin. It is important to speak with a doctor about the best treatment plan, even when deciding which over-the-counter medications are best. So, even if you're going to go pick up a cough syrup or something, you want to make sure you talk to your doctor. So some symptoms that are dangerous, and these would encourage you to call 911 because it will signal an emergency, is if a person has difficulty breathing, persistent pain or pressure in the chest or abdomen, persistent dizziness, confusion, difficulty waking up, seizures, dehydration or not drinking enough, not urinating, severe muscle pain and or weakness, fever or cough that improves but then comes back and gets worse, worsening of symptoms of chronic medical conditions. So if you have a chronic medical condition, let's say asthma, and your cough is just getting worse, it's not going away, you're staying up at night, this is a worsening symptom of a chronic medical condition. And if you have a fever above 104 Fahrenheit, or if a baby younger than 12 weeks has a fever of 100.4. So encourage your network and community to call 911 immediately if they have any of these symptoms. And I will close out my session with one last question to you all. This will also be a poll, and the question is 95% of all people hospitalized for COVID-19 in the US are not up to date on their vaccines. So we'll give you guys about a minute to answer on the screen, and then we'll see what the consensus is. So we see a lot of answers coming in so far. I know that was a lot of information I just rambled through. Hopefully it was all clear, and we will be sharing slides with you and links. So if you have any questions, please put them in the chat and we will definitely address them. Okay, wow. So everyone answered the question. So that was great. And it was before a minute. So almost everyone answered correctly. No problem. I'll just reiterate again. So 95% of all people hospitalized for COVID-19 in the US are not up to date on their vaccines. And this is true. So that's why we want to repeat to you that you should be up to date on your vaccines. This number right here showcases the importance of being up to date on vaccines. It will save you a hospital trip. So I will turn this back over to Jasmine, and she will talk to you about chronic health conditions, and more about respiratory illness.
Can everyone hear me? All right. Sorry about that. Couldn't tell if my audio was on. We will discuss chronic health conditions and how they relate to respiratory illnesses in the current flu COVID virus season. People with chronic health conditions are at risk of complications from respiratory viruses. Viruses can worsen symptoms of pre-existing conditions like Maria just finished stating, and in some cases, they can lead to new complications. In fact, during recent flu seasons, 9 out of 10 people hospitalized with the flu had at least one underlying health condition. People with lung disease who are sick from respiratory viruses are at a greater risk of developing secondary infections as well, such as pneumonia. It's important to support your community in staying ready and encouraging people with chronic health conditions to talk to their doctor about how to stay protected this season. I know, for instance, like my mother, for instance, has a chronic respiratory disease, and during the COVID and flu season, it's really important that she stays safe, stays up to date with her vaccines, because just even catching a small cold for her can sometimes lead to hospitalization. So something like the flu or COVID often leads to a secondary infection with pneumonia or things like that. So you want to remind your community members and the people in your life, your family members, if they fall into any of these categories, like with diabetes, heart disease, kidney disease, liver disease, and especially other respiratory diseases like asthma or COPD, that they should talk with their healthcare provider to make sure they are aware of their options and how to stay safe this season. So In the effort to stay safe this season, we want to remind people that it's good and important to prepare for the season before it starts. As you support your community this respiratory season, there are many steps that they can take to prepare ahead of time. You want to encourage them to talk to their healthcare provider, like I just stated, about their personal risk factors for severe illness from respiratory viruses, and to create a plan for the fall and winter. You want to help folks know where they can access the testing and treatment that we discuss if they were to get sick. Remind everyone to stay up to date on those flu and COVID-19 vaccines and RSV if they're eligible and have not yet received the immunization. Reinforce the importance of continuing prescribed medications as directed. So, you don't want to worsen your chances if you were to get sick from a respiratory illness by not taking care of the chronic condition. So, reminding people to take their medications as prescribed. Highlight You want to highlight the role of stress management in the wake of being sick and preparing for a season where uh, lots of things are going around, flu and COVID and RSV. Um, they can practice stress management with good sleep hygiene, healthy routines, and having a self-care plan strengthens the immune system. So reminding them to take care of themselves, both physically and mentally. You can share prevention tips with them. So all those prevention tips that we have hounded over and over again throughout this training sessions. So, frequent hand washing, avoiding close contact when you're sick, and improving ventilation in the home or the office can help with preventing illness. And finally, you want to suggest that community members put together an emergency supply kit. This can include 2 weeks of medications, food, water, and updated contact information for emergency contacts, healthcare organizations, and their doctors. This can help them prepare in the wake of, fall and winter season where we might have more storms, um, power outages, and things like that. Having an emergency supply kit, if needed, can help them stay healthy when things go awry. So even with the preparation beforehand, sick days still can happen. That's why it's important for community members to have a sick day plan. You want to encourage people to keep at-home test kits available for flu and COVID, so that combo test is perfect for that. They want to be able to access those testing kits quickly so they can identify what they're dealing with early on. You can remind them to monitor their health closely, especially if they have these chronic health conditions that we just finished talking about, that can make their illness with the flu or COVID worse for them if they were to get sick. In preparation for monitoring their health closely, you want to urge them to talk with their doctor before they get sick so that they can discuss their sick day plan with them. This sick day plan and topics to discuss with their doctor can include what they should eat or drink while they're sick. Lots of people say, "Oh, eat soup and drink lots of electrolytes and things like that." But if they have a chronic health condition, they want to make sure that they are checking in with their doctor about what is going to work best for them, their underlying conditions, and to help them be on the mend from their respiratory illness. Whether medications that they are taking need to be adjusted. So I talked a lot about taking their medications as prescribed. But if they have concerns about any medications that they are taking, they can discuss this with their doctor and make a plan for any adjustments that are needed. And then also discussing which over-the-counter medications are safe for them. Like Maria said, even if you just plan to pop into CVS and get a cough syrup, you still want to make sure that that is safe for you to take, especially if you're on other medications for a chronic health condition or any conditions at all. So talking with your doctor about that is the best and appropriate step. And then they can want to talk with their doctor about reinforcing the importance of knowing when to call their doctor. So, talk to their doctor about what symptoms they should be worried about. And if they were to experience those symptoms, what they should do next. Call their doctor, go to the emergency department, things like that. Their doctor can help them make that plan. Having this plan in place helps community members manage illnesses safely and reduce stress during respiratory virus season because increased stress can lower your immune system in a way and, just make you stressed out. So you don't want to be sick and stressed. You can just be sick and on the mend. So I'll go over the key takeaways that we've discussed. We have discussed a lot of things on this training. So most importantly, the flu vaccine, COVID vaccine, and RSV immunizations help protect from severe disease, hospitalization, and death. These are the reasons we get our vaccines. So just reminding people that it doesn't prevent this illness, but helps from that severe disease or hospitalization, or even worse, death. It is safe to get all three shots at the same time if you're eligible. And you can speak with your primary care provider to learn more about vaccine eligibility if you do have questions about that. So you want to protect against the big three viruses by immunizing, so getting those immunizations and vaccines, staying home if you're sick and seek treatment if needed, test if you're sick, protect yourself and your loved ones in the community by making sure that you're following all of these steps, especially with gathering for the holidays. If some ways where people can get vaccinated. So if you have a health insurance, you can make an appointment with your doctor or the local pharmacy and get vaccinated, especially for COVID at the local pharmacies. Your doctor should be able to help you get a flu vaccine as well. If someone does not have health insurance, you want to visit the local health centers that we discuss. You could call ahead to ensure availability of the vaccine that you want. And then you can also find that affordable primary care provider with our primary care finder. This is a good way to find low cost or even free healthcare. Lastly, I will just end with a question, one more question for you all. Seasonal or yearly vaccines are not important because viruses do not change. Is this true or false? I see lots of answers, most of them false. So most of the answers that were chosen were false, which is the correct answer. I just realized that sounded weird. Yeah, so everyone who answered false is completely correct. We want to make sure that you are getting those yearly vaccines. They are important because, in fact, viruses do change. So, thank you. Lastly, I'll just turn it back over to my colleague King to close us out.
And as always, we want to thank you guys for participating in today's training. Um, if you guys have any follow-up questions, concerns, or thoughts that you may want to share at us, as always, stay connected and stay informed by emailing us at publichealthpreparedness@phila.gov. If you essentially don't like to email and you want to talk to someone over the phone, you prefer to speak with someone on the phone, you can always contact us at 215-429-3016. Stay up to date with materials, with the most up-to-date materials for the fall season by requesting materials through our bit.ly link up above. Again, we can provide you guys with materials. They are free, they will be colored, and they will be printed. You can either pick them up or we can mail them to your home address. Stay up to date with Ready Philadelphia for all the things happening in the Philadelphia area, or if you want to make it more specific just to your general area, you can do so. All you have to do is text Ready Phila to 888-777. And last but not least, just making sure you join our Heartburn newsletter. This gives you all the most up-to-date information and everything that's going on within the Department of Public Health. And as always, thank you guys for your time and have a great day.